podcasts of previous episodes of this program on our YouTube channel under Freedom and Prosperity Radio. Our next guest, you read her stuff in The Bull Elephant. Cathy Trauernicht has been kind of digging into Phase 1 and why was Northern Virginia, and I guess by extrapolation, Richmond, allowed to be left out of Phase 1 reopening. Cathy, thank you for joining us this week on Freedom and Prosperity Radio. How are you doing?
I'm doing well. Thank you so much, Joe, for having me. I appreciate it.
So what have you found in the Northern Virginia societal infrastructure that made them run out to the governor almost immediately upon his announcing Phase 1 was going to commence soon and say, no, please don't make us go back to work yet? I mean, I get it. I was a high school kid who never wanted summer to end. I understand the feeling, but I'm sure it's a little bit more than that.
Well, I was curious about it, too, because I follow all the governor's press conferences, and he, in the past couple of weeks, has been very insistent that Virginia's moving forward, as he likes to say. There's plenty of PPE, hospitalizations are coming down, we have plenty of surplus hospital beds. And then Northern Virginia comes out of nowhere and says, no, we're not ready. And I thought that perhaps they're coordinating more with Montgomery County, Maryland, right across the Potomac, because they're holding out, too, from the rest of Maryland, and also the District of Columbia. Now, those three locations seem to be moving forward, opening Phase 1 on Friday, so I think there has been some kind of coordination. But I've also been wondering exactly what's going on in Fairfax County. Where are the deaths and the hospitalizations? And I'm on the Virginia Department of Health website. It takes a bit of adjusting to figure out how to work that website. And I was looking specifically at the Fairfax County Health District, and they list outbreak-associated cases. Now, outbreaks are defined as places that have two or more laboratory-confirmed cases of COVID-19. So they listed outbreak-associated cases, and of the cases, it turns out that long-term care facilities had 49 outbreaks. That was far and away more than correctional facilities have had. They were listed as having 1. Healthcare settings as having 2 outbreaks, and educational settings having 1. Now, I checked the statistics today, and long-term care facilities have had 1 more outbreak in Fairfax Health District. So now we're up to 50 outbreaks. I wanted to know what's behind those outbreaks. How many deaths does that represent? Well, the Fairfax Health District won't give that to me. But an intrepid reporter from the Washington Examiner, Susan Ferriccio, evidently called them last Friday, and they gave her the number of deaths associated with the outbreaks in Fairfax. And the long-term care facilities accounted for 75% of the deaths in Fairfax Health District.
Well, and
75%.
That goes with what we're told about comorbidities in terms of COVID-19, is that the most at-risk populations are the elderly and those with immune situations, whether it be asthma, diabetes, or other immune situations. So that why would it be difficult to find something like that? I mean, I understand personal information and HIPAA. We don't want to know names, but it's handy if we're keeping businesses closed because we're concerned for health. If we find out that, well, for the most part, the people who are coming into our business are not going to be the ones who are in danger, then we should be okay, shouldn't we?
Right. And when I've asked for the death information, trying to get it out of even people in Richmond, I always say, I'm not interested in names of people. And don't even give me the names of the facilities. Evidently, they can't do that by law. Facilities are treated as persons under Virginia law. And so, therefore, you can't find out the names of the facilities where these deaths have occurred. And Northam has talked about this occasionally in his news conferences, and he says it's something for the legislature to address next time they come in session.
That's his dodge.
So there's more transparency. But I went ahead and called the Fairfax County Health District yesterday. I thought, well, if they're going to give a reporter the death statistics, I'm going to say, why shouldn't I, as a private citizen, have this information? I called them yesterday. They danced around the issue, said, well, this is something that's now mandated by the Medicare and Medicaid Services Department. I'm not sure I have the name right. It's at the federal level. So the federal government is now mandating that nursing homes release information about their COVID deaths. So she tried to pass it off on the federal government, and I said, well, the federal government is going to be getting its data from you, the local level. So start with me and tell me what your deaths have been. She was not comfortable with that question, and I kept pressing her, and she finally said she would talk to the epidemiologist in the office and then get back to me. It might be a day or two. So let's see if they give me the health figures that also corroborate 75% of the deaths in Fairfax Health District or from long-term care facilities.
Wouldn't it?
I have been wondering if the politicians are being lobbied by the healthcare and nursing home industry to keep this quiet.
Well, it seems interesting. It reminds me of a story from ancient broadcasting history. I used to work in Lancaster, Pennsylvania, and there was a horrible condition of animal breeding known as puppy mills. And the puppy mills are one of the largest economic drivers in the Amish community. And the Pennsylvania legislature looked the other way for years under the idea that it was religious freedom and that they couldn't target it because of religious. And finally, it took one attorney general to say, no, it's a consumer protection issue that we need to know these things are going on and we need to punish people. So it almost seems like the same kind of thing would be, this is a consumer protection issue as much as it is, somewhere where you have to walk a thin line with privacy. But a consumer, if I'm looking for a nursing home for my mother, or whatever the politically correct term is, care facility for my mother per se, I'm going to want to know, is this one got 4 stars, 2 stars, 1 star, from the state? I mean, that's just consumer protection.
Exactly. And I wonder if some of them are also afraid of being sued now because they haven't been open with what's been going on. Family members can't even get into these facilities.
Sure.
So how do they know what's going on inside? And for the poor patients who are confused and don't understand either, they're not going to be a source of information.
I know it was New York State, but you saw that horrific video of the mentally ill young man who went, physically violent against other nursing home patients because he had been put there because he was COVID positive, but was not mentally stable enough to be in a population of other people, certainly not ones incapable of defending themselves when he lost, control.
Right. And there's also been a problem of healthcare employees, I don't like to use the word worker, but healthcare employees moving from facility to facility because they have multiple jobs there. And maybe there wasn't proper screening early on. And I think we did know fairly early on in this crisis that the older population was going to be vulnerable. And I was looking back at the timeline of all the pronouncements that Ralph Northam has delivered. And it was March 12th when he declared his state of emergency for COVID-19. Almost a month later, April 10th, is when he announced his task force to help nursing homes and long-term care facilities. Almost a month later, think of the time that was lost.
Oh, sure.
And the woman, Dr. Lori Furlano, who heads up that task force, was asked yesterday in the governor's press conference when they might be able to split out comorbidities and let people know what the underlying causes of death were. And she reacted like, well, that's an interesting idea. We'll have to look into that.
Let me ask you that, Cathy, because that's bothered me about all of the governor's pressers, is, you're doing it. You're doing it at 2 o'clock. There's a room full of press. Yet every time they're asked a question, it seems like the answer is, well, it doesn't matter whether it's Brian Moran or Dr. Furlano or the governor himself. It always seems like, gee, I hadn't thought about that. You knew you were having a press conference at 2 o'clock, and you have it every other day. Come in with some answers. It just seems like a dodge after a while.
And no one follows up. I mean, I'm watching these press conferences, and I'm thinking, why didn't you follow up with this question? Or often they don't even answer the question, and they just ramble a response and then move on to the next person. And the reporters, I don't think, are doing a very good job. They're not pressing the governor. And on the mask issue, the governor, it's almost 2 months ago, I guess now, as a physician, he said masks aren't really going to protect you unless you have medical grade. Now, yesterday he said, you don't need a medical grade mask. Just make something out, go on the internet and figure out how to make something, even with rubber bands.
Which is what we were saying a month and a half ago, and he said, no, that's not going to help.
Right.
It's amazing.
Right. The mask wearing bothers me, but that's probably a different topic.
Well, no, and I've taken a stand on it that I'm doing it. I have bandanas. I'm not going to get fancy with a medical, but I like the kind of cowboy look anyway. But I'm wearing
when you go to the bank.
I'm not wearing it to protect me. And I've talked to doctors from Southeast Asia. I've talked to medical professionals from around the country. The mask wearing is not to protect you. It's to protect other people, because at this point, and South Korea is leading the charge into this, it's about the only place where they're trying to figure out why it is people who are contagious don't even know they have the disease yet. And that's the scary, dangerous, frightening thing about this. It's almost like a George A. Romero movie. How do we know who's got this virus yet? And it doesn't seem like in all these press conferences anyone's ever addressing that issue or who's working on it.
Well, and Joe, remember at the very beginning we were told the incubation period is 2 weeks. That's why even today, when there's a quarantine period, it's 2 weeks. We're going on 3 months.
Right.
I'm not sick. So why do I wear the mask? To show people that I might be sick and I don't want to infect you. I've had 3 months. I'm not sick.
Let me ask you this about Northern Virginia, Cathy. Inova Health is the first hospital in the Commonwealth laying off employees because they were so quiet. Why? That was what really jumped out at me when Northern Virginia said we don't want to join phase one. I said, you got your major hospital system laying off employees because there's no work.
Well, and of course they're laying them off because this was part of flattening the curve. We weren't supposed to go to the hospital for elective surgeries. We were supposed to leave the hospitals open to treat COVID patients. And I think this was fairly true around the country. Even in New York, they didn't need the hospital ship. Was it the Mercy, I think, that was in New York? They may have used a few beds in there. The Javits Center hardly had any patients.
That's right.
So this was all part of flattening the curve. And they were laying off hospital employees, doctors, nurses, staff, because they didn't have enough to do. So we do need to bring back the hospital industry. They were hurting. And I was surprised that, of course, we were able to get elective surgeries back online a couple of weeks ago, so that probably helped a little bit. But certainly, Inova is a big enough presence. You would think they would have the governor's ear and at least get back up to speed.
Well, and that's, I guess, that was why, when it became the opportunity to have you on the program, that's what really jumped out at me is if we can't even keep the hospitals busy enough, why are we all keeping our businesses closed?
Exactly. And also another story that's not getting, or another statistic that's not getting enough attention is the recoveries.
Yeah.
Most people recover from this. When I was looking at the demographics on Virginia Department of Health website, most people who test positive are sort of in this 40 to 50 age category. The hospitalizations then mostly in the 60s, and the deaths by far are over 80.
Mm-hmm.
So it's saying, middle-aged people can get this, but they're recovering. The people who end up in the hospital, I would like to know about their comorbidities.
Yes.
So if we're going to really get an accurate picture of what's going on, we need to understand underlying health conditions. And the governor and his health commissioner talk a lot about underserved communities.
Mm-hmm.
Well, I remember Michelle Obama was trying to get people to eat healthy food.
Yep.
I don't think it was that successful, but we know that certain communities may not have access to healthy food, although I think that has improved. But you're also asking people to take responsibility for their own health. And maybe that's what Governor Northam needs to start focusing on. How do you get people to take responsibility for their eating habits?
Cathy Trauernicht is on with us. She's a reporter. She's a writer for the Bull Elephant. You read her stuff in there and some of the Northern Virginia papers talking about phase one and why people were recalcitrant from joining it. And you brought up something there, right? And I want to jump into this because I've called this the petri dish of the politically correct. This virus has bred in our inability, everything we've just been talking about, the inability to say older population, the inability to point to comorbidities. When I brought up the Wuhan province health issues, the horribly polluted air, the off the charts diabetes and asthmatic conditions of the citizens of the Wuhan province, I was told that's racist. And I'm not really sure how that was, but, of course, that's like dropping the nuclear bomb on Hiroshima. As soon as you say the R word, conversation must end at that point.
Right.
But we can't. How do we protect somebody until we say, hey, maybe this ethnicity, maybe this poverty-stricken area? I'd like the governor to follow through and say these 30. I think he had 30 poverty-stricken areas, or the areas where the average income was under $30,000 a year. Well, why aren't we doing something economically developmental on those areas to help them be not so impoverished? If anything, maybe this is identifying some of the places where the policies of the left have failed these communities economically.
Yes. Absolutely. Yet they want their votes.
Right.
And sanctuary counties have sprung up, and Fairfax County has been accused of being a sanctuary county. They won't accept that moniker, but we have a significant illegal population, and that needs to be addressed. Also, let's look at the poultry processing plants down in the southern part of Virginia.
Sure.
For decades, refugees have been resettled in meat and poultry processing plants around the country. They're cheap labor, and they live in tightly populated areas. This is where that outbreak occurred down on the Eastern Shore about a month ago.
That's right.
And it was part of the Delmarva meatpacking plant industry, so Maryland was seeing the same thing. And when I talked to people about this, they hadn't focused on the fact that people working in these conditions and living in large populations are from refugee areas. They're being, you could say, they're being exploited for cheap labor. We have gotten used to relatively inexpensive products thanks to cheap labor. Now you're seeing some meat shortages. My husband was out at Costco yesterday, and he said there was hardly any meat. This is because of the meat packing
the factories
plants being shut down, and in large measure, it's the refugee population.
Well, and you bring up
People,
another thing. I mean, you're talking about people who are, even if they are legitimately in the country, they're from societies where trusting government agencies is a mistake because they come from, corrupt countries of South and
right,
Central America. And if they're
right,
not here, they're certainly not going to go seek medical help. So,
right.
this is, perhaps the fruit of everything they sowed with trying to be a sanctuary for illegals.
Right, right. It's both.
Yeah.
The illegal population and then the refugees. Refugees are big business,
Yeah.
and Catholic Charities is very big down in the Richmond area. So you want to do a little story on refugee resettlement sometime, and it's eye-popping. It's big money for the refugee resettlers. There are 9 agencies that sound like they're all part of religious groups, and they have a special arrangement with the State Department, and they bring in the refugees. They get paid by the head, and then the refugees. I actually volunteered for one of these refugee resettlers a couple of years ago, and as soon as the refugee arrives, they get on the public dole in Virginia. They get health benefits. They get food benefits, housing. I'm not saying they shouldn't. They're brought here.
Right, they have nothing to start with. But
told
here's the interesting thing is we've seen this in our flagship city where the IRC operates. You'll have one house with 4 refugees in it, each getting housing for a full house, and the landlord's not just double dipping, quadruple dipping.
Yeah. It's big business. So you start peeling back the layers of these issues. You have a health crisis like this, and there's certain communities that are more susceptible to the crisis. We need to know that and to understand what's going on. I think we're being frightened into think. I mean, I know a couple of our neighbors who've barely been out of their house. And they've been frightened to think that the virus is stalking our streets. And now, with the mask wearing and told you might be contagious, they're making people afraid of themselves.
They're using this as a way, Cathy. Don't you sense this that this is designed to? And you had mentioned tort earlier in our conversation that a lot of this is now all of a sudden waiting for the first civil rights lawsuit or the first COVID discrimination suit.
Right. And I think I had heard that Mitch McConnell in the Senate really wanted some sort of indemnification for businesses. So they can see this coming. This will be the next point of division in our society, pitting people against each other. And in the grocery stores, I think, one grocery told me that they want people wearing masks because if somebody comes down with COVID, they don't want to be sued.
Well, sure, absolutely. That was, I think, really what was behind the governor's quote order without any enforcement was so that the employers could then have this cover of, oh, I'm just doing it because the governor told me to.
Right. Did you notice yesterday he was asked about the enforcement, and he said he does not want to punish people. He's not going to have police and other members of law enforcement out there enforcing the ban, but he did, or enforcing the mask requirement. He did hold out the possibility that when the General Assembly comes back in for an emergency session later this summer, they could consider civil penalties.
Right.
So, again, they're just ratcheting up the control and the fear, and this is not healthy for, as Governor Northam says, moving Virginia forward.
Oh,
this is not the way to do it.
But who has always been one of the biggest puppet masters in the left is the tort lawyers, the personal injury attorneys. That have you been sick for no fault of your own? Call 1-800. Got COVID.
You can see it coming.
Oh yeah, no,
I
absolutely.
just wanted to mention one other thing. I don't know how much time we have
got
left.
A couple of minutes.
Okay, I want people to also understand that state employees during this crisis have not lost one job, except for some hourly employees at parks, for instance, or different concession areas. They can file for unemployment, but no state employee has lost their job. And I asked the Fairfax County chairman of the Board of Supervisors if any Fairfax County employee had lost their job, and he said no. And he actually, I can read this quote to you. He said, "Now more than ever, the work of local government is critical. It is my hope that no one is furloughed or laid off during this pandemic."
Wow.
I find that appalling.
Yeah.
So government, which exists because we give them our tax dollars, especially on the local level, they can't print the money. They've got to collect it. But the hubris of him to think that government is somehow special, and we need our government to be functioning while we collapse.
Yeah.
The hubris is beyond my comprehension. I just want to make sure that your listeners know about that.
Well,
no reporter will ask it, and I've asked a couple of reporters, please bring this up at the press conference. No one will touch it.
Well, this is what we've been bringing up for the entirety of this. I've had people that I work for say you need to go 24/7 COVID, health news, blah, blah, blah. I said, not while our local governments are still meeting in secret using even a system that Attorney General Herring said is not designed for public comment on things like tax rates and budgets, but they're doing it anyway under this guise of continuity of government in a society whose first three words are "we the people." That angers me, Cathy.
I know. It angers me too, Joe.
Well, I appreciate everything you do. The Bull Elephant is where you can read your stuff. Also, you said the Washington Examiner, some of it as well. And
well, I haven't been in there yet. I was once in the Washington Times.
Oh, okay,
was
good
paper
as well.
That was another thing.
Oh gosh.
But the Bull Elephant, they can go on. It's a fun blog, primarily focused on Virginia, and I've written several pieces there. And you can look, and the latest one is called Northern Data, when we were looking at the data that he relies on. And I will say one more thing. He relies on this data that seems to be ever-changing, but the data he's never talked about is the unemployment data and how many people are filing for unemployment insurance. He doesn't talk about that. That's not of concern to him. He has talked about wanting to make sure that the consumer is comfortable as they go back. Now, where have we heard keeping someone comfortable? Let's see. A newborn baby on the table while the mother decided with the doctor what to do.
Well, now we know how that baby felt. Cathy, thank you so much for joining us this week on Freedom and Prosperity Radio. And thank you all for listening again. VirginiaInstitute.org. And until next week, on behalf of all of us here, so long, and thanks for all the fish.